Hello friends, today I am going to discuss with you another important topic, cardiotocograph and component of CTG trace. In exam, there are questions come in the form of they gave you a scenario and a trace. If you know the component of trace, you can easily answer the question. In this video, I am only focusing on cardiotocograph and the component of the trace. The interpretation, I will discuss that in another video. CTG is a continuous tracing of fetal heart rate used to assess fetal well-being together with an assessment of uterine activity, also known as electronic fetal monitoring. Preparation before performing CTG. First, you should determine indication, take consent, very important, ask woman to empty her bladder, determine lie and presentation, check maternal heart rate to differentiate between maternal and fetal heart rate. Women should be in semi-recumbent or left lateral position. Now CTG machine settings, you should set CTG paper speed at 1 cm per minute. You can see in the picture when you increase the speed of the paper from 1 cm per minute to 3 cm per minute, see there is lot of difference. So it is very important. Then set fetal heart rate range display at 50 to 210 beats per minute. Ensure correct date and time. Label CTG with mother, hospital ID or number. Now this is normal CTG trace. Reactives. What are the component of CTG trace? There is baseline rate, baseline variability, presence of acceleration, and presence or absence of decelerations, uterine contractions. Now on display, the vertical line, the interval between the vertical red lines represent 1 minute. This is very important. And the fetal heart tracing is displayed in the upper pan and uterine activity is displayed in the lower pan. Now this is very important. Fetal heart rate tracing, large box is equal to 1 minute, small box is equal to 10 seconds horizontally. You can see in each large box there are 6 small boxes. So each small box horizontally represent 10 seconds. Or similarly, small box is equal to 10 beat variability vertically. Now what is baseline rate? The level of fetal heart rate when this is stable and after exclusion of acceleration and deceleration. Normal is 110 to 160 beats per minute. When it is less than 110 beats per minute, it is called bradycardia, and if it is more than 160 beats per minute, it is called tachycardia. Baseline variability, it is a degree to which the baseline varies. It is the bandwidth of baseline after exclusion of acceleration and deceleration. Variability of 5 to 25 beats per minute is normal. 0 to 5 beats per minute as reduced and more than 25 per minute is saltatory. Acceleration, a transient rise in fetal heart rate by at least 15 beats over the baseline lasting for 15 seconds or more, or prolonged if more than 2 minutes but less than 10 minutes. Deceleration, a reduction in the baseline of 15 beats or more for more than 15 seconds. Now there are type of decelerations, which is variable decelerations, earlier decelerations and late decelerations. There is a mnemonic in which wheel chop. This is the mnemonic for types of deceleration and in which conditions they are present. Variable decelerations are present in cord compression, earlier decelerations present in head compression, and late decelerations are present in placental insufficiency. So wheel chop, you can remember it. Now variable decelerations correspond to cord compression. The onset does not coincide with the contraction. may occur at the beginning or the end of the contraction. So they have no relationship with the uterine contractions. They are variable. Earlier decelerations, they correspond to head compressions. The onset coincides with the onset of the contraction. See, the deceleration starts when the uterine contraction starts and ends with the contraction. See, there is mirror image. The nadir of the deceleration corresponds with the peak of the contraction. You can see peak trough relationships. The peak of the uterine contraction and the trough of the decelerations coincide. This mirror image of the contractions, it is not pathologic. Important thing. See another image. You can see that the both have the same onset and their peak and the nadir coincides, and both recover at the same time. An early deceleration is defined as the waveform with a gradual decrease and return to baseline with time from onset of the deceleration to the lowest point of the deceleration, more than 30 seconds. So the onset and the lowest part have more than 30 seconds. The nadir of the early decelerations occurs with the peak of the contraction. So late decelerations, the corresponds to placental insufficiency. The onset coincides with the peak of the contraction. So you can see when there is a peak of the uterine contraction, at that time the late deceleration starts, and the nadir of the deceleration occurs at the end of the contraction. You can see the nadir of the deceleration is at the end of the contraction. Here another picture. See, the onset of the deceleration and the peak of the uterine contraction coincides, and when the uterine contractions end, there is the nadir of the deceleration. Late deceleration is defined as a visually apparent gradual decrease in the fetal heart rate, typically following the uterine contraction. The gradual decrease is defined as from onset to nadir taking 30 seconds or more. Now another component, it's uterine contractions, which is present at the lower pan. Record number of contractions in 10 minutes. Always record the contractions in 10 minutes. Example 3/10, 3 contractions in 10 minutes. For uterine contractions, each big square is equal to 1 minute. So to record the uterine contraction, you have to see it for 10 squares. Contractions should be assessed for duration, strength, and frequency. Uterine contractions should be less or equal to 5 in 10 minutes. But if the contractions are more than 5 contractions in 10 minutes, it is called tachysystole. And uterine hypertonus contractions lasting more than 2 minutes or after every 60 seconds. And what is uterine hyperstimulation? It is tachysystole or hypertonus plus fetal heart rate abnormalities. Montevideo's units. These are method of measuring uterine performance during labor. 1 Montevideo unit is exactly equal to 1 millimeter of mercury within 10 minutes. Generally, above 200 Montevideo units is considered necessary for adequate labor during the active phase. Thanks for watching.